Asanteni sana Mawelchi Cultural Dancers. Kikundi cha mwisho, Your Excellency, kutuletea burudani asubuhi ya leo ni Community Health Promoters kutoka kaunti hii. Kikundi hicho tuwakaribishe kwa makofi wakiwa wamevalia sare zao nzuri za kazi.
Nisie tuida afya yetu jukumu letu. Asante mama taifa, mama wetu Ruto, kufungua hospitali, mama Ruto Maternity, kujali maisha ya mama na mtoto tumboni. Tunashukuru serikali ya taifa na ile ya kaunti kushirikiana pamoja maswala ya kiafya. Maternity wanapeana basic care for mom and baby. Waliojifungua postnatal care service iko. Asante mama taifa, mama wetu Ruto, Potoma economy transformation inatekelezeka. Ikiwemo primary healthcare tunaitekeleza. Iso stipends vigi tumesipokea. Serikali ya Kenya kwanza aje tumetimiza. Asante gavana wetu, gavana wa raia, nguzo kumi Uasin Gishu, ya pili ni afya. Kaunti yetu twashukuru, munatudhamini. Hizo stipends na mafunzo zinatusaidia. Vifaa vyetu vya kazi umetupatia. Tunapima pressure, sukari na kupeana dawa tunazoruhusiwa kupeana. Asante community promoters madaktari vijijini. Tunazuia magonjwa yasichiuke kule kijijini. Tunafikisha ujumbe wa afya kule kijijini. Tunapeana huduma ya afya kule kijijini. Sisi ndio mstari wa kwanza kwenye vita na magonjwa. Asante mama taifa, mama wetu Ruto, kufungua hospitali, mama Ruto Maternity, kujali maisha ya mama na mtoto tumboni. Tunashukuru serikali ya kitaifa na ile ya kaunti kushirikiana pamoja kwa maswala ya kiafya. Individuals, organizations, partners, NGOs, afya yetu msinga na zetu ya kiafya sana kama asante mama taifa, mama wetu Ruto, kufungua hospitali, mama Ruto Maternity, kujali maisha ya
kushirikiana pamoja kuongoza masuala ya kiafya.
Maternity wanapeana basic care for mom and baby. Waliojifungua postnatal care service iko.
Asante mama Taifa, mama wetu Ruto. Bottom-up economy transformation inatekelezeka, ikiwemo primary healthcare tunaitekeleza. Hizo stipends tumezipokea. Serikali ya Kenya kwanza, ahadi yetu ni taifa.
Community health promoters. Tuwapigie makofi tafadhali wote ambao wameweza kutuletea burudani asubuhi ya leo. Tunasema asante. Mheshimiwa Mama wa Taifa, sasa tutaingia katika kipindi kingine cha kutoa hotuba, na wa kwanza ni Daktari Mkuu wa Hospitali ya Kina Mama ya Kujifungulia ya Mama Rachel Ruto, Daktari Lois Luhumio, ambaye atatoa hotuba ya makaribisho. Tumkaribishe kwa makofi tafadhali.
Her Excellency, the First Lady of the Republic of Kenya, Mama Rachel Ruto, the CAS, the PS, the Governor, Uasin Gishu County, all the dignitaries and gentlemen, good morning. Good morning. It is such a great day that we are here this morning. We are very happy and proud as a nation, as a county, as a facility, and as a community. The day that we have been waiting for has finally arrived. Mama Rachel Ruto Maternity Hospital, previously known as West Maternity Hospital, has come a long way, way before even some of us were born. And this facility has been a beacon of maternity health and the health of mothers in the county and beyond. We are known for providing the best health care. We are known for providing a friendly environment, and that is why we and the county has been able to uplift and upgrade the facility to the level that it is. When you come to Mama Rachel Ruto Maternity Hospital, you will find an environment where all the staff are very friendly, where all facilities are available, where all the specialties are represented. For example, obstetrician and gynecologist, pediatrics, mental health, specialist nurses, theater services, among us many, that the community has been yearning to have. So this morning we are proud and we say that we are all welcome to Mama Rachel Ruto, a beacon of health, a place where all comprehensive services are going to be held. And so, it is with great pleasure and profound joy that as we gather here today to mark the official opening of this historic and remarkable maternity hospital, on behalf of Mama Rachel Ruto Maternity Hospital, I extend a warm welcome to you, Your Excellency Mama Rachel Ruto, and each and every one of you. Your Excellency, as we embark on this momentous journey together, I am reminded of the words of Benito Mussolini, who once said, War is to man what maternity is to a woman. And I do not believe in perpetual peace. But I do know we cannot have peace when mothers still need care during pregnancy. We cannot have peace when our mothers need care during childbirth and after childbirth. Your Excellency, these words resonate deeply with your commitment to the health of mothers and babies as the mother of this country. The journey leading to this momentous occasion has been one of dedication from the county office spearheaded by our Excellency the Governor, dedication and collaboration and unwavering commitment of the well-being of our community. And today, as we stand in the proximity of this great facility, we are filled with gratitude. Gratitude for the tireless efforts of all those who are involved. From the visionary leaders who initiated to this project, to the skilled architects, engineers, and builders who turned this vision into a reality. Mama Rachel Ruto Maternity Hospital stands not only as a symbol of progress, but as a beacon of hope for countless families in our midst. It is a sanctuary where the miracle of life will be nurtured and celebrated, where mothers will find comfort and care during pregnancy, labor, and birth, and where every newborn will be welcomed into the world with love and compassion. And as we embark on this new chapter, let us remember the profound impact this hospital will have on the lives of generations to come. Let us cherish this moment as a testament of our collective resolve to prioritize and save the lives of mothers and their precious babies. In closing, I would like to express my heartfelt gratitude to all those who have contributed to these momentous achievements, and may this hospital serve as a shining example of excellence in maternity care, and may it bring joy and comfort to all who pass through its doors. So, ladies and gentlemen, thank you and welcome to Mama Rachel Ruto Maternity Hospital.
Ruhusa yako, Your Excellency. Sasa nitamwalika mwenyekiti wa bodi ya hospitali ya kina mama ya kujifungulia ya Mama Rachel Ruto, Bwana Kelvin Mulwenye aweze kuzungumza. Tumkaribishe kwa makofi tafadhali.
Your Excellency, the First Lady, Mama Rachel Ruto, Your Excellency, the Governor, all protocol observed. Ningependa kuwasalimu nyote kwa jina la Yesu. Hamjambo. Hamjambo tena. Yangu kama bwana mwenyekiti wa hospitali sina mengi, ila nina furaha mwingi moyoni ya kwamba siku ambayo sikudhania itatimia imetimia siku ya leo. Ya kwamba mwanga na nuru umeng'aa juu ya boma letu, na leo tumeinuka, tuko kwenye kiwango kingine. So bila kupoteza wakati mrefu sana, ningependa tu kuamsha the board And I want to say thank you very much for honoring this gesture of partnership that is before you. Is now Mama Rachel Ruto Maternity Hospital. It rose from back then in the days of the colonial. Who was here, was moving out. He donated that space for the use of healthcare. And we as the community that live here because every time we've been nominating a council, a committee, and now a board to help this facility, we were able to always talk to partners and reach out so that we are able to bring in resources to better that facility. We are very glad that every time we've raised our hands as a community to reach out for support, we have gotten friends from Finland, from Safaricom, and we have also gotten others from USAID, and we have also gotten others from the French government. And now we have you as a friend. Wapi makofi mazuri jamii, kwa sababu leo tuko na rafiki mkubwa sana ambaye ni mama wetu wa taifa. Na siku ya leo mama mbele yetu, tuko na ombi kama jamii. Wakati hili jamii lilikuja pale kwa kiwanja la hospitali likatuita, and they made a gathering out of that, we actually was given a mandate by the community. The mandate that we were given as a community was that we may be able to reach out to partners, and make this a better place and provide an oversight for this facility to grow better. And today, we are glad that we are going through a vision that we've placed before our community, and I'm glad that the government, through the government of our very honorable governor, has presented a proposal to you. And I want to assure the members of the community that the proposal is with Mama, that we are now ready to raise this facility and create a baby wing, and create an inpatient wing, and create a state-of-the-art theater. And it is going to be equipped with very sophisticated and very life-changing equipment, as you see on our screens. And on this last slide, Mama, there are a few immediate things that we as a community would really love to see in this hospital, even before that 1.3 billion project comes up. Then we were praying that we would get some ambulance. We are praying that we'd get to do a utility vehicle. We are praying that we'd get a morgue. We are praying that we would do some few things on the immediate as we grow on up. And with all these things that are before us, we are really grateful that, Mama, you have come in. We are ready to open our boardroom for various discussions and partners to take this facility to a greater height. What else could we say as a community, Mama, but just to say thank you very much for this occasion. And we want to take this opportunity for His Excellency the Governor. Na tunasema asante kama jamii. Maternity Hospital. Thank you very much.
Kwa ruhusa yako mama wa taifa, sasa nitamwalika naibu kamishna wa kaunti eneo la Soi, Bwana Solomon Chepotom, ambaye atawatambua viongozi wa serikali kuu waliofika na vile vile kumwalika gavana wa kaunti ya Uasin Gishu kutoa hotuba yake. Karibu.
Okay, asante sana. Your Excellency Mama Rachel Ruto, Governor Uasin Gishu, Principal Secretary, and all protocols observed. Jambo. Mine, Your Excellency, will be very brief. First can be seen. Asanteni sana, ketini chini. Now, let me also take this opportunity to introduce other national government officials who are here. On your permission, national government officials, chiefs. Yes, they are seated at the background. Asanteni. Welcome you to Uasin Gishu County on behalf of the County Commission. sana Governor Uasin Gishu.
Hakuna makofi kwa governor. Asante sana. Your Excellency, the First Lady of the Republic of Kenya, Mama Ruto, Principal Secretary for Public Health and Professional Standards, Mary Mudhoni, partners who are here, spouses to the governors, one from this county, Selina B. Stand up and wave. Very good. Spouse to my friend Rotich of Elgeyo Marakwet County, Salamia Pia, and spouse my ladies of the counties also appear. I think maybe it is a habit or something. Other dignitaries, ladies and gentlemen, good morning. With us we have very many dignitaries, but allow me, wherever I see Dr. Kogos, I know Senator Mandago is around here. Thank you very much. Karibu sana. Do you have any representative from the area, Member of Parliament? Okay, thank you very much. And before I continue, we have our area MCA. Our area MCA is Lagat, and area MCA, you will introduce all other MCAs. Maybe the protocol says that today there are no speeches. It is so professional and healthy that they don't want us to make a lot of noise as usual. So allow me just to introduce the speaker, who will introduce the rest of the MCAs who are here. Karibu Bwana Speaker. Oh, thank you. You are reminding me, I have a deputy governor. Deputy governor is away, but the wife is around. I'm so sorry. You rarely, you've sat next to another white lady, so that is your sister. But allow me humbly to welcome the spouse to my deputy governor. Stand up, Daktari Parorot. Thank you so much. Pole sana, karibu.
Thank you, Governor. Your Excellency, the First Lady, Mama Ruto, Excellency Governor, Excellency Principal Secretary, who are present today. Good afternoon. My name is Philip Muigei, Speaker, County Assembly of Uasin Gishu. I have been given this opportunity to introduce my members of the County Assembly. So kindly, honorable members of the County Assembly and any other member of County Assembly from the neighboring counties, kindly come in front here so that you can introduce yourself. All members of the County Assembly.
All members present.
So I think Your Excellency, from my right, that is Honorable Sharon Jewel Kogo, nominated MCA from Ainapkoi. Thank you so much. Next is Honorable Veronica Burgay, nominated MCA. Next is Pamela Ngetich, Honorable Pamela Ngetich, nominated MCA. Next, Next is Gerald Kiplagat, nominated MCA. Next is Honorable Samuel Sawe, MCA Kamagut Ward. Next is Honorable Moses Kebenei, MCA Kapsaret Ward. Next is Honorable Patrick Kimayo, MCA Moisbridge. Next is Honorable Isaac Samoe, MCA Kapsaos Ward. Chirchir Rebecca, that is Honorable MCA from Queenette Kapsuswa Ward and Chair of LT Committee. Your Excellency, I will just request 1 minute for her to speak because she is the Chair of LT Committee and this hospital is under her. So kindly, Honorable Rebecca Chepchirchir, 1 minute alafu ndampatia area MCA.
Thank you, Speaker. Our First Lady, Mama Rachel Ruto, Governor wetu wa Uasin Gishu County, wageni wetu wote na wasalimu wa mjambo. Ya pili, nataka nichukue nafasi hii nishukuru sana mama wetu kuja kutufungulia hospitali yetu ya West Maternity. Hospitali hiyo tunaomba Madam First Lady tutibu pia watoto kutoka 0 age to 5 years kwa sababu kule referral hospital Gishu for Africa, it's so congested. We as a county, we feel we need a hospital for young babies. And today you are here and we feel the blessings already. Finally, kwa niaba ya wamama wote yalagat konga muga inyo. The star is wajiemoni. Kwamba yalagat ko masusur chigot soko na megorista. Kongoi.
Thank you, Mheshimiwa Rebecca Chepchirchir. Now, before I release honorable members, I'll request the area MCA, Honorable Gilbert Lagat, to speak on behalf of all members.
Thank you. Asante sana Speaker wetu, mama wetu wa taifa na wageni wote walialikwa. Kwanza nasema karibuni Kiplombe Ward. Jambo langu la pili, kwa sababu nitasema kwa uchache, ni kwamba shukrani mama wa taifa kwa kuwa rafiki ya Kiplombe. Ile request nataka kusema, kama Kiplombe Ward tuko na 2 big facilities ambayo ni ya national government. Hiyo tuko na pale Moi Barracks na sasa hii ni facility ya pili na jina inaitwa Kiplombe. Imejulikana kwa sababu ya cemetery ambayo iko sehemu ya Queenette Kapsuswa. Kwa unyenyekevu kwa wale ambao wanahusika, tunasikia kwamba kuna hospitali kubwa ambayo inaletwa kule sehemu ya Kiplombe, na ninaomba it will be unfair to the people of Kiplombe wakati hospitali hiyo itatolewa na ipelekwe kwingine. Tumekuwa tukiombea, tumekuwa tukingojea, tumekuwa tukihitaji sana, na wakati tutakapoletewa tutajua kwamba serikali hii imetuchunga na tuko ndani ya serikali. Otherwise nasema asanteni na karibuni.
Thank you, Honorable Gilbert. Now you can have a seat, honorable members. Your Excellency, I will just pinpoint one thing, that on behalf of the County Assembly of Uasin Gishu, where the budget making process is being done, I want to pledge our support as a County Assembly of Uasin Gishu that for this, our county hospital, which it's under county government of Uasin Gishu, we will as much as possible to allocate the resources that will enable this Mama Rachel Maternity Hospital to prosper. Thank you so much. May God bless you and may God bless Uasin Gishu. Asante sana.
Thank you so much, Bwana Speaker. Together again, we have our partners who have really helped us, and they are good friends. It will be very good for us to recognize them, and we get to know them. We have AMPAT, represented by Professor Kimaya. Professor, just come and say hi, just 1 minute. I know you have some time. I think you're the tallest here, I think.
Has our largest, they give us the largest support, and we also have the largest number of patients that we treat. But what I want to say is that this facility, West Maternity Hospital, my sisters were born here. Mimi sikufika hospitali, nilizaliwa nyumbani. But Your Excellency, we really thank you for gracing this occasion and for allowing us to name it. And we know this facility will prosper. Thank you, Your Excellency.
Thank you very much, Professor. Our USAID of Fry, you want to say something? Yeah. No.
Good morning, everybody. My name is Heidi O'Brien, come from the United States government and USAID. First of all, it's a real honor to be here, and I recognize the presence of Your Excellency, Rachel Ruto, Excellency from the Governor of Uasin Gishu County, Permanent Secretary, my friend Mary Muthoni, and county government, national government officials, all protocols observed. I come to you bringing greetings from Ambassador Meg Whitman from the United States government. The United States government is a proud partner of the Kenyan government and the Kenyan people, specifically in Uasin Gishu County. This is one of our largest areas of support in health, and we're really honored to be here. And we're really honored to be here to be naming this facility after you and Mama Rachel Ruto Hospital. It's really an honor to be here, and it's an honor to have been able to support this facility. We provided essential equipment for this facility, as well as critical staffing and training for healthcare workers to ensure that the quality of care that's provided at this facility is top-notch and the best in the country. So it's really an honor to be here. Over the past decade, United States government through USAID has devoted $158 million in investing in improving maternal child care in Kenya. And we know that those quality services are provided across the entire country. USAID has supported essential health care for the people of Uasin Gishu, focusing on HIV prevention and care for orphans and vulnerable children, cervical cancer screening, gender-based violence response, and primary health care. We've supported increasing the number of primary health care networks in the county to 9, and we're really proud that this is one of the hubs of PCNs in the county. With the amazing work of the Ampath Uzima program, we've promoted primary health care by training community health promoters on the electronic community health information systems and establishing PCNs. In addition to providing quality maternal child care, this facility also provides quality HIV care. Just 4 years ago, there were only 18 clients receiving HIV care in this facility. Now, with support from the United States government and in partnership with the Kenyan government and the leadership of the Uasin Gishu County and His Excellency, the Governor of Uasin Gishu County, we're proud to say that this facility went from 19 just 4 years ago to 266 today. The United States government is committed to fostering Kenyan prosperity by working together to improve healthcare access and outcomes. We are investing in the well-being and potential of the Kenyan people. Healthy families are the foundation of a thriving society when mothers and children receive the care they need. They are better equipped to contribute to their communities and drive economic growth. This hospital, we are confident that will play a vital role in that vision for the future of Kenya and the prosperity of the Kenyan people. As we gather to open and rename this expanded facility, and this be a place of healing, hope, and excellent care for the families and communities. Asante sana. We're very proud as the United States government to be partnering with the Kenyan government today. Thank you so much.
Thank you, Oprah. Those who come from this region, that is still English, right? I hope you picked everyone. Thank you very much. Allow me again to recognize HealthSmed Group. HealthSmed is a friend to this county. We did sign an MOU with them last year of 427 million, I remember, 37 million. And that's where we are seeing this drone. The drones you are seeing here will have been launched today. And you'll be seeing a lot of them flying in the county, taking samples here and there. Kindly Kipchumba, we've named him Kipchumba because he has a very hard name. So just say something kidogo and then we have the Siemens, but Kipchumba will talk on their behalf before we proceed. His name is Heron. This guy is a Jew. He knows all about Moses and the prophets.
So since my name is Kipchumba, I must start with Chamgei. And Kongoi Mesin for the people of Uasin Gishu, and Kongoi Mesin for His Excellency the Governor for hosting us, Your Excellency Mama Ruto, PS Mutoni, and the rest of the dignitaries. HealthSmed is very committed to support the county and the rest of Kenya. We start the journey here by improving the diagnostics in the county, making sure that people will be able to diagnose close to their facilities, to their homes, and the drones will bring it, the samples and the specimens to the whole county, to the central hubs and advanced laboratories that we are investing. In the old days, or the previous days, Siemens equipment was just for private hospitals. You will go to Nairobi Hospital, you go to the big ones, and you try. Here it will be in Uasin Gishu. In each one, will be able to receive that advanced diagnostic in the county. Kidney function, liver function, any test, diabetes test, all this one will be affordable and in the county. I want to say in a word from the Bible that it's not coincidence that this place is called Mama Rachel. Already the prophet Jeremiah was talking about it many years ago, that Rachel was looking on the people of Israel and were deported, and she wept for us. But God told to Mama Rachel, take out your tears. There is a reward for your prayers, and your prayers will follow us and will make sure that this county and the rest of the county will be successful and will bring health to the people. As Isaiah said, to the far and the near, both will be healed, so said the Lord. Thank you.
Thank you very much, Kipchumba. I knew you would quote a scripture before you sit. I didn't know she would talk about Rachel. We see this kind of, the Siemens brother is here, I recognize you, you've traveled from far. The team, all of you stand up. Yeah, and I was just imagining this is a new thing in our county, and if I was the one operating this pilot to this thing, I will take it to someone's home who is sick, and everybody will be healed. You don't have even to do anything. Just direct it to an old go. So again, as I always I have our CECs around. CECs, mawaziris, many It's the first time for us to be close to Excellency Rachel. Simama mbele, tuko na chief officers pia and the rest of the county government, the directors, but with your permission, allow me to introduce the CECs. Kila mtu sika microphone, sema jina dakika moja. Of course, unaanza na CEC wa health. And today don't look healthy kama jana.
Your Excellency, the First Lady, I'm Abraham Serem, CC for Health. Karibu nyumbani.
Your Excellency, the First Lady, Excellency Governor, my name is Dr. Kotut, CC for Water.
Your Excellency, First Lady, and Your Excellency Governor, I'm Joseph Lagat, the CCM for Roads. Thank you.
Your Excellency, Mama Rachel Ruto, my name is Elijah Koske. I'm the CCM for Public Service Management and Devolution. Thank you.
Your Excellency, Mama Rachel Ruto, Mama wetu wa Taifa, my name is Dr. Janet Koske. Mimi ni Waziri wa Lands, Fiscal Planning, Housing and Urban Development.
Our Excellency, Mama Rachel Ruto, our National Mom, our Governor, all dignitaries. My name is Engineer Lucy Ngendon Joroge, the CC member for Youth Affairs, Sports, ICT and Innovation. Thank you.
Your Excellency, Mama Rachel Ruto, all protocol observed. My name is Edward Sawe. I'm the CCM for Agriculture. Welcome.
Your Excellency, the First Lady, my name is Edwin Bett. I'm the County Secretary.
Excellency, the First Lady, Mama Rachel Ruto, the Governor, and all dignitaries. Good morning. I'm Engineer Martha Cheruto, Waziri in charge of Trade, Industrialization, Tourism, Cooperatives, and Enterprise Development. Karibuni.
Your Excellency, the First Lady, the Governor, Uasin Gishu, all dignitaries. I'm CTNA Anthony, Waziri Education, Vocational Training, Gender and Culture. Karibuni.
Thank you very much. You can choose to sit. Asante sana. Again, we have the French government. I don't know whether they send a representative. The reason why we have that facility is because actually they sponsor the facility. French government, if any? Okay, fine. We will give you later our message. We have our town chairman, city chairman. You don't have to come in front because you're already known. He's the only one who has that stature. Thank you, Kitur. Kitur is a friend of this town for many years. Our town manager is away in Ghana for some official function. Asante sana Kitur. Yeah, makofi kwa Kitur, you know. Asante sana. So allow me, Your Excellency, just to read this very small message. And before that, again, we have seen the first family. Kuna kitu naitwa first family. Kuna first lady, but first family. Wazazi wetu wa mama wa president wetu wa Kenya, Dr. William Samoei Ruto ako na sisi. Na pia baba wa Rachel Ruto, Our Excellency yako hapa. Na sisters na brothers, if possible, mungesimama alafu mupeane mkono namna hii watu waone. Tunawakaribisha kwa heshima. Bas muendelee kufanya hivi. Makofi tafadhali, makofi. Do you know it is a blessing that we are a home to the President of the Republic of Kenya? Do you know that? That the President comes from the neighborhood. And this county, we are so blessed. So someone said if you go to Siaya, don't throw any stone anyhow. You might hit a professor. But here, please don't make a mistake of throwing stones. You might hit the president or the governor. Be careful. All leaders come from here. With us again, we have the clergy led by our very own bishop. All the servants of God, please be upstanding and wave. Thank you very much. We recognize you. It is because of prayers that we always have in the morning that you are seeing this success. So today, we celebrate the launch of Mama Rachel Ruto Maternity Hospital. We are honored to have Our Excellency First Lady with us. It is not normal, it is not common to have a first lady with you for 2 hours or 3 hours. This is a miracle. And thank you, Your Excellency, for allowing this 70-bed facility to be named after you. To us, it is a big thing, and we really say thank you. This facility comprises state-of-the-art equipment worth $1 billion donated by the French government through the FCE program. In this regard, I wish to thank the French government for this immense gesture extended to the people of Kenya and to our progressive county. This equipment include state-of-the-art operating equipment, and I saw you saw that one, you are there. 20 general incubators and 2 highly specialized tunnel incubators, the only of their kind in Western Kenya. And where we beat our big sister MTRH is that they only have 1 specialized tunnel incubator. We have 2 in our small hospital here, Mama Rachel Hospital. It is a 40-bed antenatal care and postnatal care wards and modern delivery beds. And I can feel the spirit of expectancy here. We feel very pregnant, all of us, because when we were there, we had how many babies born? 4, 5, or 6? The other day when I was inspecting, we had 3 children born. So I think we should hang around here for more babies. So don't be in a hurry to go. There could be miracles happening here. So this hospital is a significant step of our community, focusing on the welfare of women and children. Its location will ease the burden on women who endure long queues at nearby hospitals. With this new facility, our mothers will have access to a dedicated referral center for various health conditions, including gynecological units for reproductive health issues. This facility will offer curative reproductive health, maternal and child health services, and enhance skills development among other health care workers. A healthy community, Your Excellency, is the foundation of a productive society. That is why we are committed to improving and equipping all our 138 healthcare facilities in the county. Your Excellency, yesterday we did receive a consignment of drugs from KEMSA worth 37 million Kenya shillings, which will also benefit Mama Rachel Maternity Hospital, shifting from the initial format of storing drugs at the store. This facility will encourage our mothers to transition from home deliveries to using advanced hospital equipment for safeguarding the health of both mothers and newborns and minimizing maternal death. Since yesterday and the other day that I've been here, I've never witnessed a child die just because he's been born. And I remember when Professor talks about him being born outside the hospital, we are quite a number. I am part of the team. You can't tell where I was born, in the kitchen or around the compound or along the road. Thank God I've been born anyhow. A good example, Your Excellency, that, when I assumed office, we found heavy investments in the health sector that were not commensurate with the budget. These were multi-year projects whose minimal allocation has been set aside a few months before the election. And I have discussed that with you, that we need more funding outside the exchequer, because this exchequer will not, it will not complete this unless it is multi-year and many other years. Even in my term, I don't think we will complete these projects, but still we are committed to making sure that we do or have a progress on these hospitals. A good example is Ziwa Level 4 Hospital, which was started, and even before the construction was half completed, another facility was started. Even construction of mortuary began, and many others. So I think we need a lot of funding. These major projects had huge allocations that, if funded, will consume the entire Now that you here and the First Lady just declared that there are funds and we declare these facilities done. We are embracing technology to advance our health sector, and through collaboration with institutions like HealthMed, we have introduced drones for diagnostics in remote areas, crucial for transporting specimens and blood samples, saving lives and reducing transport costs. This technological leap will be a game changer for our healthcare workers. Our commitment to healthcare services across the county is evident through significant investment. In Ziwa Sub-County Hospital, we have established a renal unit and the Ziwa Maternity Theatre is near completion. We also have dental and eye unit in that hospital. Advanced construction of ICU and HDU and casualty units have been completed, awaiting equipment installation. The Kesses Sub-County Hospital is 83% complete and set to become operational in the next financial year. The Uruma Eye Unit Clinic Reference Lab is ready for operation and drone services are starting today. Plans are underway, Your Excellency, to introduce X-ray services at Moiben Sub-County Hospital, Soshani Health Center, and Casteldon Sub-County Hospital. We recently distributed oral health kits to over 40,000 ECD learners, and their introducing this toothpaste and whatever. We also introduced school milk for our early learners, and I'm told it is part of the nutritional values that we require for the health of the child. So we are moving on. Our projects are and the medium-term plan 4 that we had the other day. We are committed to universal health coverage, ensuring affordable health quality services to all. Our healthcare strategies aims to establish a model hospital in each of our 30 wards, a plan that requires a robust support. Your Excellency, our 2005 community to facilitate referrals needing specialized care. My administration has stabilized the provision of essential drugs. It is currently enhancing our healthcare infrastructure, a move that requires additional hospital to baby hospital, mother and baby hospital. Our plan is also to improve infrastructure and equipment in existing projects, such as Kesses Level 4 Hospital, which requires another 400 million for infrastructure and 450 million for equipment. Actually, we are now the equipment part of it. We need 450 million. And that one, we will pray to the God of Kipchumba to provide. The Ziwa Hospital requires 122 billion for infrastructure, but from halfway now, we need 450 million for equipment. Moiben, 300 million for infrastructure and 250 million for equipment. Talbom is 800 million for equipment and ICU and ADU units. And then Ban Forest also 100 million. Finally, we express our heartfelt gratitude to our First Lady pledge and pledge our support in promoting quality healthcare for all. And today, we are very happy, First Lady. You could open our hearts, you will see a lot of joy inside. And somebody said, if people were eaten, they would have eaten you and you feel good, because it's so good to have you here. Thank you so much. direction. For your information, the people of Uasin Gishu County, God has given us so many success stories. Let me mention the next one that is coming is us being awarded a charter by the President. Kama city, we're seeing a lot of investors coming and investments taking place, and then the challenge of unemployment from our youth, you will be able now to get jobs. That one we trust, and I have faith that it will work. So allow me niseme asanteni sana, Mungu awabariki. Naomba sisi wote kwa na msiamuke, kumbe kuna mwenye atakuwa mwisho sana. Tuamwishe Madam PS akuja atusalamie, atupatie hiyo reporting, and I know my prayers and my requests have been heard. How I wish in your speech God will use you to answer some of these, and if not all of them. Thank you very much.
Thank you, Governor. Your Excellency, the First Lady of the Republic of Kenya, His Excellency the Governor of the great county of Uasin Gishu County, ladies and gentlemen, hamjambo. Kigorena Mary Modhoni, aka Chepchumba. Sikuna Kipchumba. Sasa mimi ni Kipchumba. Of Daktari William Samoei Ruto, and in the pillars of the bottom-up economic transformation agenda, health stands out. And when I stand here today and I see this hospital, my heart settles. We have gone round the hospital equipped to the core, and I can tell you for a fact, most of our hospitals in this country, one of the things that lack is equipment. But Mama Rachel Ruto Hospital is equipped, and our mothers are safe. The naming of this hospital as Mama Rachel is not by coincidence. It is because you are now the de facto champion for women's health. And the women of this country are happy for that. I want to applaud His Excellency the Governor of this county, that he has embraced technology. And where we have come from, I have seen the drones moving from one place to the other. Really, technology, digitization is the way to go. We cannot be left behind as a country in terms of digitization. And note that this government, we are riding on digitization as another agenda. Mimi, Your Excellency, I grew up in Kirinyaga County. Na mama yangu tulikuwa wengi. Mpaka wa leo akona sanduku kubwa ameweka vitabu. Tulikuwa tunaenda nazo hospitali. Kalikuwa kuota exercise book, lakini vitabu si za kuandikia za watoto. So in implementing digitization, there is the Digital Health Act, which is already in place because the President assented into law, the Digital Health Act of 2023, that the interrelatability of our facilities, that if there is anything that is missing here, either in terms of equipment, in terms of human resources, we can be able to link a patient, a mother from this hospital, maybe to your sister MTRH. Na akifika pale, daktari atakuwa na mgoja, anamuuliza wewe ndio unaitwa Jane, nimeambiwa umegonjeka hapa, blood pressure imeenda juu, na unatibiwa. So, really, digitization and technology is the way to go, and I thank the county government for embracing this in a very big way. Drones. Tulikuwa na changamoto sana, and especially during COVID, that we could never leave our homes, our households,
even to go and buy a medicine. Now, if something like that happened in the country again, this is what is going to help us. You have seen people being swept by the floods, that vehicles cannot even cross rivers. Therefore, if we have technology like this of drones, we will be able to transfer medication, diagnostics from one health facility to the other. So I really thank God that I am living in this time and age when we all are together and are moving in the same direction. Your Excellency, allow me to just mention one thing about our insurance. These days, even when I go to my village, I can tell them everything else. Lakini mwisho ananiuliza na mambo ya NHIF. So allow me to assure the people of Uasin Gishu County that we are on course. And the transition from NHIF to social health insurance is in good hands. One, nobody will ever be sent from any health facility, be it a private, public, or faith-based, kwa sababu hauna pesa, or because you do not have money. We have taken care of everyone. If you're not in the caliber of paying the 300 shillings, nakumbuka NHIF ulikuwa unalipa 500, now it is 300 shillings. Then if you're not in that caliber, you will pay 2.75 like myself, so that we can take care of everybody else. And if our means assessment will be able to tell us that for sure you're not able, then the government is going to pay for you. And mothers who will be coming here are covered in the Social Health Insurance Fund. And the Social Health Insurance Fund, Your Excellency, the very best thing that has happened is because we have 3 funds in it. One is called the Primary Care Fund, yenye itashughulikia the hospitals, the dispensaries, the health facilities yenye tunaita level 2 and level 3. The other one is the Social Health Insurance Fund, ile tulikuwa tunaita NHIF. And now we have the Chronic Illness Fund. Mamangu akiwa nyumbani, ama mama zangu wale wako hapa, akigonjeka, and the disease is a long-term disease like cancer, mambo ya dialysis, tunashinda kwa WhatsApp sahi, tukichangia kila mtu, everybody will be treated. If your card for social health insurance haifikishi pale, then we have a fund called the Chronic Illness Fund. We will not go into harambes again. Serikali ndio itakusimamia hata ukiwa na hiyo ugonjwa kubwa. Asanteni, our community health promoters. And Your Excellency, as I wind up, allow me to tell you what these people have been able to do. That in the last few months that they have been working since they were trained, equipped, and rolled out by His Excellency the President, 141,000 mothers have been identified. Have been told either there's something wrong with you, please go to the health facility. Because sometimes we stay at home and we do not even know whether we are sick. These community health promoters will be the link between the households and the health facilities, like Mama Rachel Ruto facility that is here. Checking your blood pressure, your blood sugar, kukumbusha mama mjamzito to come for clinic, to ensure the children come for immunization, ndio as a country tusiweze kupatwa na magonjwa ile ndogo ndogo kama ya polio mtoto akipitisha miaka 5. So reminding the mothers and the caregivers that they need to go and visit the health facilities. And in the few months, child health, 3.6 million, 69 million under 5 years children have been assessed by the community health promoters. Na wako na simu. Wakifika mahali, wanafinya pale, wanaingiza hiyo data, mimi nikiwa kwa ofisi ninaangalia. That is why I know, Your Excellency, thank you very much for gracing this occasion and His Excellency for even inviting me. Allow me to remind the people of Uasin Gishu County that every third Thursday of every month is the tree planting day. Climate change and health are intertwined at the hip. Tusipopanda miti, tusipochunga mazingira, then homa zingine na magonjwa mengine itakuja ikatupata. Respiratory diseases which we can prevent from home. Thank you so much. And now it is my singular honor. Please rise, all of you, na mpige makofi mpaka Her Excellency afike kwa podium. It's my singular honor, Your Excellency, to invite you to the podium and address the people of Uasin Gishu County.
Thank you, the DJ. Thank you for that beautiful song. I think we will also sing it at the end. Your Excellency, Jonathan B. Chelilim, Governor of Uasin Gishu County, and your spouse, Selina B. Neri Mudoni Muriuki, Principal Secretary for Public Health and Professional Standards, elected leaders present, spouses of governors present, national government and county government officials present, partners, members of the clergy present, ladies and gentlemen, good afternoon. Bwana asifiwe. Hebu nione mikono yenu watu wa Uasin Gishu. Bwana Yesu asifiwe. Asante sana. The national government bottom-up economic transformation agenda, BETTER, has listed healthcare as one of the key pillars towards the responsibility of our nation. The county of Uasin Gishu continues to be a leader in this sector, and I must congratulate the county government and private sector for the rich investment you have made towards the health of Kenyans' citizens. This is why I'm especially delighted to join you today to launch various innovations and facilities within the county's health sector to ensure that all our people access better health care. I bring you greetings from our President, Dr. William Ruto. He expressed his appreciation for every collaboration and innovation aimed at better serving our people. This morning at Huruma Sub-County Hospital, we launched the first of its kind project in the nation, where the county will be using drone technology to collect medical samples from 117 public health facilities in the county for analysis at a central facility and relay the results back to the health centers electronically. This collaboration between the county government of Uasin Gishu, Elsmed from Israel, Wingcopter from Germany, and Siemens Group is a national case study on the optimization of healthcare resources by leveraging technology to ensure there is proper diagnosis before treatment. The partnership will further improve healthcare access by patients, especially those in far-flung areas who have been traveling to main towns to access quality laboratory testing. They will now enjoy the same services at their nearby healthcare facility. I have received information that the drone will transport medical samples from the Chagiai Health Center in Ainapkoi constituency, which is the farthest healthcare center in the county, to Huruma Sub-County Hospital in just 7 minutes. By road, the samples would have taken 40 minutes to an hour, depending on the traffic on the highway. Ladies and gentlemen, with Eldoret being a medical hub in the North Rift region and the country at large, the existing medical facilities, especially maternity, have been overstretched, and the maternity hospital is a stitch in time. With a capacity of 70 beds, this first of its kind specialized maternity hospital boasts the latest equipment and technology to ensure the safety and well-being of mothers and children. I'm humbled to have the maternity hospital named in honor. Thank you very much. We thank all partners for supporting this hospital with the latest equipment and training. This will advance the country's capacity to offer maternal, neonatal, prenatal, and pediatric care for mothers in the county and the larger North Rift region. The facility now boasts a fully equipped theater, a Class E laboratory, a fully stocked pharmacy, an ultra-modern diagnostic ultrasound, an X-ray unit, and an ICT center. This facility has a rich history, beginning as a white settler residential unit during the colonial period and later evolving into a small dispensary given as charity by the colonialists. Founded in 1967 and expanded in 1993 with the aid of the government of the Uasin Gishu district, this facility was originally meant to serve government staff living nearby due to its proximity to the town center. According to the Kenya Demographic Health Survey 2022, 14.4% of women in Uasin Gishu cannot access a health facility within 1 hour when they need healthcare services. The operationalization of this hospital will improve access to specialized maternal and neonatal healthcare services and act as a referral facility for mother and baby emergency cases, ensuring that no mother should lose their own life while giving their outstanding commitment to healthcare, as evidenced by the 30% allocation of their budget to health. We look forward to the construction and operationalization of the Ziwa Level 5, Keses, Moiben, and Tarbo hospitals. Ladies and gentlemen, our national healthcare journey has been long, expensive, and sometimes out of reach for many Kenyans due to geographical barriers and income disparities across the country. Kenyans have consistently requested that healthcare services be the most desired public service. Indeed, the projects that we launched today provide a resonance between the bottom-up economic transformation agenda healthcare pillar and the Nguzo Kumi manifesto by Governor Jonathan B., which gives top priority to the provision of quality and affordable healthcare. This is a significant step in realizing the Kenya Kwanza manifesto commitment to achieving universal healthcare coverage by integrating technology for healthcare delivery and fully functional primary healthcare mechanisms, including preventive, promotive, curative, palliative, and rehabilitative services. We urge the residents of this county to embrace the rollout of the Social Health Insurance Fund, which will see all Kenyans access quality health care without exclusion, in line with the policy of leaving no one behind. I encourage the county government of Uasin Gishu to pursue further partnerships and technology integration in service delivery. May this county and the country at large be a model of excellence in public health care for the Africa continent as a whole. I will conclude my remarks with scripture from Ephesians chapter 6, verse 7, and I quote, "Serve wholeheartedly as if you are serving the Lord, not people, because you know that the Lord will reward each one for whatever good they do, whether they are slaves or free," end of quote. With those few remarks, it is my singular pleasure to officially launch the Huruma Sub-County Hospital Drone Diagnostic Services and the Mama Rachel Ruto Maternity Hospital, Eldoret. Thank you so much, and may the good Lord bless you. As I conclude, ningependa kusema tu jambo moja. Kwanza kabisa, kuendelea kumshukuru gavana wetu wa Uasin Gishu, Mheshimiwa Cheli Lim, kwa kazi nzuri ambayo umefanya pamoja na watu wa Uasin Gishu. Mambo ya kina mama ni mambo muhimu sana katika serikali ya Daktari William Samoei Ruto. Na wacha niseme kwamba hii hospitali itasaidia kina mama wengi. Na wakati nimetembea hapo nimefurahi sana, maana nimeona kina mama wengi ambao wameweza kujifungua. Hata kuna msichana mmoja amezaliwa, ameitwa Rachel. Kwa sababu ya hiyo najua kwamba kuna mambo mengi mama anahitaji wakati mtoto anazaliwa. Na mimi ningependa kusema kwamba kwa watoto ambao wamezaliwa jana, wamezaliwa leo na wengine watazaliwa bado leo, ambao watazaliwa kesho, hizi siku tatu, mimi nitatoa supply ya mwaka mmoja ya diapers. Asanteni sana, Mungu awabariki.
Kwa heshima yako mama wa taifa, naomba usalie jukwani. With your permission, Your Excellency, we'll request you remain on stage. Because of a photo session, I'll request our governor and our PS kindly join Her Excellency on stage for the photo session. The board, the hospital board, Mama Rachel Hospital Board, kindly join Her Excellency on stage for the first photo. Thank you. The hospital board, kindly join Her Excellency on stage for the first photo. The hospital management, DJ hold kindly. The hospital management, get ready. That is the first photo. Board joining Her Excellency for the first photo. That is our first photo. For the second photo, we'll request the board kindly exit the stage. The board exit the stage as we ask the hospital management to join Her Excellency on stage for the second photo. The hospital management kindly join Her Excellency on stage for the second photo.